I'm Dr. Patty Ford, and I want to talk about the statement that was said this week. It is 2025, and it is June. And so by the time this gets posted to YouTube, it might be a little bit later. But there was a statement said by leaders that he wants all Americans to wear wearables. A wearable is a device that tracks any sort of biometrics, sleep, heart rate, body temperature, steps. So there's many different devices on the market, from a Whoop band to Aura Ring to Apple Watches, and there's all the different kinds of brands. So it doesn't necessarily need to be those brands. However, there's also something that's come out called the continuous glucose monitor. And there's many different ways that you could invest, you could track. There's many different companies that are doing it, some through insurance, some not. And so what's happening is we're getting access to our own live data without any sort of medical intervention by a professional, which is sometimes not necessarily needed. However, if I was going to get my taxes done, I could probably figure it out myself, but I want to go to someone that's experienced, professional, that's had a proper training. And so it's wild to me how science has now been, there's a lot of mistrust with the medical community. And so I totally understand how and why, and I can have a lot of empathy for what's just happened in the last 50, 60 years, especially in the last 10. So none of these belief systems are right or wrong. But the problem that I find personally is you have close to 100 million people who are either without insurance or underinsured. So they're simply trying to figure out how to, out of 350 million people, that is what? That's a third of the United States of Americans are underinsured or don't have health insurance. And what can happen then is, now coming from a public health standpoint, we're asking people to invest in a wearable, which could be $100 to $500 with continuing monthly fees. And they don't even have access to basic health care. Who is going to help them interpret the data? It's a little nerve-wracking that people might turn to free resources like Google, which is not necessarily free because you're paying for either internet or the device that you're using. But now we're suggesting that someone invest further in a personal responsibility device that you don't have any education or access to people that can help you interpret the device, at least not in a timely manner. And so in my anecdotal experience, when someone has over access to data that creates a nervous system response of fear, which typically your adrenal glands then secrete cortisol, which your biology will then secrete glucose into your blood, which jacks up your blood sugar. And if you have a wearable, then that can be like, oh gosh, I haven't eaten anything, but my blood sugar is high. I must have diabetes. And that's not how diabetes works. It's not even how it's diagnosed. You need a lab workup of your blood sugar readings over 3 months in order to diagnose. So it's one of those, yes, maybe checking your blood sugar a few times a day. When I was an initial dietitian, we were thinking that would be awesome if everyone could just walk around and check your blood sugar. But the real time blood sugar data of every 30 minutes and then get alerted, it's like having a notification if you're speeding. And maybe you don't speed so much where it's fatal, or speed so much where you get a ticket, but every now and then you get an alerted. Imagine that having about your biology, where if things are sometimes out of whack, but your biology is able to correct enough where you're back to homeostasis. We don't need to know all of that all of the time. It's not inspiring at all. Motivation and inspiration are different. And if you truly want to transform and make people healthy, you want to act from inspiration. You want to understand how to inspire people so they can breathe on their own, not out of fear or motivation and obligation. It doesn't work. It creates havoc and fear and actually creates more disease. So no, I don't agree that everyone needs a wearable, even though I have one and I personally invested in one. I do believe I have the education and access to care that I'm able to interpret data cautiously. If you have any questions, let me know what your thoughts about wearables down below. Okay, bye.